So, Dr. Gongal sir, please.
Thank you very much for introduction.
Sir, 1 minute just I request all the participants, please start your video so that we can take one group photo along with Gongal sir, please. All the participants are requested, please start your video.
Okay.
Bhakti, Chirag, Dr. Anu Singh, Dr. Ashish, all the person on the screen, please start your video. Dilip Singh, Meena, Dinesh, Dipin Chandra Yadav, Dr. Anu Singh, Dr. Chitra, Abhishek Joshi. Chalo, come on fast. Huh? लेकिन सबका फोटो वीडियो स्टार्ट प्लीज पिक अभिषेक जोशी एनी सुप्रिया दीप शिखा चित्रा जैदा ओके जैदिया अपेक्षा अभिषेक जोशी इज देयर और नॉट दीपक सोनी.
Once again, all the participants are requested, please start your video.
वास्कर सर नमस्कार. अजून एक लाइन 2 लाइन राहिल्यास. भक्ती स्टार्ट युअर व्हिडिओ. भक्ती आपलीच आहे ना स्टुडंट. चल. Okay, thank you. Yes, sir. So I invite Dr. Gongal sir to speak on One Health initiatives for the AMR. Gongal sir, please.
Okay, thank you very much. It is my great pleasure to make presentation on One Health initiative for antimicrobial resistance. Let me try to put everything in order first. Let me try to see. I think, okay. So now I have to get rid of this one subtitle. Okay, now you can see.
Yes, sir.
Yes.
Yeah, and you can hear well, yeah?
Yeah, very well.
Okay, thank you very much. Just I would like to give a short introduction why we are dealing with antimicrobial resistance and why food safety and EMR and One Health are interlinked, and antibiotic use in food production and in its impact on international trade. WHO initiative for containment of AMR, One Health initiative for AMR that is now quadripartite, and international partnership for containment of AMR, and what are the take-home messages. So the epidemiology of antimicrobial resistance is very complex. This graph clearly shows that there are various factor determinants for emergence of AMR gene, and it is widely used not only in human health but also in food animal, companion animals, and when we use antibiotics, definitely it will pass through stool and this fecal material, and it will also contaminate the environment. And there are also antibiotics which are date expired, and there is no proper disposal system, so it will contaminate whole environment. And here in human health side, we mentioned travelers. We all know that NDM1 gene, it was first reported in a Swedish patient. So that is just example that it is a transboundary issue. And we get antimicrobial AMR gene through food chain, and that's why it's used in food animal. That is a matter of concern. And resistance is a biological phenomenon. Even Alexander Fleming, when he was receiving a Nobel Prize for invention of antibiotics, he clearly said that it will be misuse, abuse, and there will be resistance problem. So even he foresee that what is going to happen, and that is really happening. And at one point of time, people are thinking that we'll get rid of all infectious diseases, particularly bacterial diseases, because we have penicillin. But it did not appear to be true. So now we are getting this antimicrobial resistance problem because it has been extensively used for treatment, prophylaxis, and growth promotion. That we have to understand that it is widely used in agriculture, animal health, human health sector, and even food product, this processing, as well as in laboratory condition. And we have to understand that these antibiotics, antibios means against life, you see, and also kill innocent bystander bacteria, which are non-pathogen and which are helping us in digestion and other things. So these bystander bacteria, which are non-pathogen, and the use of antibiotics also promotes antibiotic resistance in non-pathogen too. So like typhoid, we are using chloramphenicol or any other antibiotics. Definitely, we have to take for certain period of time. And then this is passing through our alimentary canal, and then it also promotes antibiotic resistance in non-pathogen. And these non-pathogen may later pass their resistant genes on to pathogens. So this is the situation we are facing. And there are several studies like high prevalence of MCR2 encoded colistin resistance in commercial E. coli from broiler chicken in Bangladesh. Similar report, it has been reported from Indonesia. And there was eye-opening when there was report of high prevalence of colistin resistance and MCR gene in E. coli isolated from pigs in China, because that has been used for human being, and that is also used in food animal production. And globally, 73% of all microbials sold on earth are used in animal raised for food. And since 2000, meat production has grown by 68%, 64%, and 40% in Africa, Asia, and South America, respectively. So Asia, 60% of the global population are living in Asia, and it is becoming a powerhouse for development, technology, and all those things. So that's why the consumption of meat is expected to be high in coming years. And there is an estimation that the use of antimicrobial agents for food animal production is expected to nearly double in some countries by 2030. And these are the BRICS countries, including India. And the use of antibiotics in animal and plant intended for food can result in resistant bacteria being transmitted to human through food chain, as I have mentioned. And fungicide is extensively used in plant production that may lead to antifungal resistance. This is the gray area we have not touched. Now WHO came up with priority fungal pathogen to be monitored for antifungal resistance. And if we see the geographical distribution of AMR in low and middle income countries, it clearly shows that the proportion of antimicrobial compound with resistance higher than 50%. First graph, we can see Asia is the major hot spot for this resistance. And when we talk about this difference in proportion of antimicrobials, 10% resistance and 50% resistance, it clearly shows that we have hot spot in Asia, and blue areas are established hot spot. So in that sense, antimicrobial resistance is an emerging problem, and if we do not take action, if we try to go as it is, then by 2050, 10 million people, they are going to die. That means patients are going to die, not because antibiotics are not available, because available antibiotics are useless and it did not work, and it will extend the hospital stay, treatment duration. And our Asia Pacific region is a hot spot for emerging AMR gene. If we see the report from OIE, it clearly shows that the quantity of antimicrobial agents used in animals is very high in Asia, Far East, and Oceania. And the global consumption of antimicrobials is 117.48 mg per kg of animal biomass. And we see what is the situation in Asia Pacific region. And EMU data was submitted by 156 World Organization of Animal Health members. And highest antimicrobial usage in animals, more we use, more threat of AMR. So that we have to understand very clearly. And what is the pattern of using antimicrobial substances in human health and animal health? So in human health, it is self-medication, like there is no need of prescription, and even you have viral infection, but you are using antibiotics, although it does not work. But we are trying to say that we are trying to prevent secondary infection. And if you go to dentist, you are also given antimicrobial substances to prevent secondary infection. But in animal health sector, it is use of antibiotic growth promoter. Officially, there is a report that many countries, they have banned use of antibiotics as growth promoter. In reality, it is different. And because enforcement of those regulation, it is a big challenge. And patient compliance, underdose or overdose. Like there are also quacks, they will give latest antibiotics, and once fever is over, they will try to say that there is no need of use. And because of poverty also, people cannot take antibiotics as recommended by doctors. In animal food production, we know that we can minimize the impact of antibiotic use by enforcing withdrawal period for milk, milk discard time, as well as if it is used in food animal, we can try to minimize the residue in meat and other products. So it is a food safety concern. Antibiotic sensitivity test, it is done, not regularly, but at least it is practiced. But in veterinary side, it is only for companion animal, cat, dogs, and other animals. Over-the-counter sale of antibiotics, that is same problem in animal health and human health. So farmers, they do not want to go to veterinarian because they have to pay this fee, and that's why they will go to agrochemical agrovet, and they can just get it. And use of new and expensive drugs, that has been pattern, because medical doctor, they do not want to lose their patients, and that's why they will use latest antibiotics, broad spectrum antibiotics, and that also lead to antibiotic resistance. In veterinary side, it is economic factor that plays a role. So we are not ready to use latest antibiotics. And life duration of illness, as I mentioned, hospitalization rate and duration of treatment, it will be important in human health side. In animal health side, definitely this is trade, food production, and food security. Counterfeit drug, it is a major issue in human health sector, but it is minor in animal health sector because there is cost issue. If we see the sale of food producing species in microgram, that is production corrected unit of various veterinary antimicrobial classes. The survey was done in 31 European countries in 2017. And this is proof of concept that we can minimize the use of antibiotics in animals, of animal food production. So we can see Scandinavian country like Sweden, Norway, Iceland, and Finland, they could reduce uh, the antibiotic use in animal production. Whereas there are countries like Cyprus, Italy, and Spain, they are using a lot. And penicillin and tetracycline, they are most widely used. It accounts 57% of the total amount. And yeah, it is very challenging to come with this kind of data and information because the different animals are involved, different prescription modality are there, and the different methodology are there. So it was complex exercise, but they came up with some data and information. And reduction in the amount of antibiotics used in agriculture livestock in the Netherlands. So we can see that it is still widely used, particularly in poultry and pigs, and fattening of this beef cattle and turkey, but they have dramatically reduced the use of antimicrobial substances in food animal production. So this is a proof of concept, but we have to invest on vaccine as well as biosecurity. And that is possible in their setting because they have organized farm. But whereas we have backyard poultry and this scavenging pigs, so that is a major challenge. EMR is also linked to international trade. Importing country or trade bloc put food safety and quality requirement to exporting countries, which may include livestock and poultry products, fish, seafood, and honey. And there are critical to make decision for import. Number one is evaluation of National Veterinary Services, which is known as PVS. It is done by OIE. And India has done this only a few years back because that is also linked to disease freedom status and risk assessment. So that is most important. There should be regulatory framework. There should be animal disease surveillance system in place, laboratory capacity for investigation, detection, and validation. So we may have this laboratory facility for detection of antibiotic residue, sensitivity, and other issue. And residue monitoring system, this is very, very important. It should be accredited, it should be validated, veterinary drug, residue, and pesticide and mycotoxin. And the most important for antibiotic use in animals is veterinary drug supply, sale, and use in feed. So these are the parameters they try to see to make decision for import of animal products. And farming practices, it is also very important that biosecurity, vaccination, and management, these are the important issue to be taken care while evaluating national veterinary services. European Union, in particular Article 118, aimed at implementing the global consensus on addressing the global health risk of antimicrobial resistance by preventing the use of medically important antimicrobials for growth promotion purposes. There is this issue in WTO SPS committee. Unfortunately, they could not get support, and that's why they are implementing in their country starting from this year. And revision of code of practice to minimize and contain antimicrobial resistance. So it was produced in 2005. Now it has revised, and it is important that there should be code of practice, particularly in food production. And guideline on integrated monitoring and surveillance of foodborne AMR has been developed. And use of whole genome sequencing in international trade of animal products, it is going to happen. Now whole genome sequencing, it is most common because of this COVID-19 pandemic and this influenza. So that technology is going to be cheaper, and now this is the way forward in future. And antimicrobial resistance, definitely it is a global problem, global challenge, and we need global solution. So there is high level political interest and commitment. It is started with Global Action Plan on AMR developed by WHO and adopted at the World Health Assembly. And majority of countries, they have developed national action plan for AMR, including India. In 2016, it was discussed in UN General Assembly, and OIE and FAO governing bodies also endorse Global Action Plan for AMR because few strategic objectives. It cannot be implemented without the help from World Organization for Animal Health and FAO. And in 2018, 3 organizations signed MOU to strengthen their long-standing partnership with a strong focus on AMR in a One Health context. And there is also other development like international political commitment, as well as political declaration on universal health coverage, call for a dedicated high-level meeting on AMR. And there was high-level dialogue, which was held in 2021, and for urgent action to tackle AMR. And particularly in low and middle income countries, it is the focus of international political commitment. So there is global leaders group on AMR. India is represented by Dr. Sunita Narayan from this CSE, India. And this global leaders group on antimicrobial resistance, Sheikh Hasina Wajid from Bangladesh, and also the Prime Minister Barbados is involved as a part of this global leaders group. And the main objective to strengthen global political momentum and political leadership on AMR. So particularly low and middle income countries, they have limited capacity, they have commitment, but how to enforce those commitment, that is a real challenge. So this GLG came up with 6 priority action area for 21-22. So advocate or sustain political action on AMR using One Health approach, and advocate for transforming the food, animal, and human health and plant and environmental ecosystem, focusing on IPC, as well as biosecurity and other measures. Advocate for improved surveillance and monitoring of antimicrobial use and resistance, EMU or AMC in human health side, and AMR. So across the sector, so risk-based approach, and advocate for increased mobilization of internal and external financial resources. We may have excellent national action plan, but to implement that, we need resources. So that is very, very important. And advocate for increased and effective and affordable innovation. There is an organization, NGO called GUARD. They are also working to develop bedside or field this penside test, try to understand EMR gene as well as EMR issue, and advocate a better understanding of environmental pathway. This is one of the area where we are lacking clarity. So now United Nations Environment Program is also part of this one. So how it affects environment, this is the new area that we have to focus. And global action plan on AMR, there are 5 strategic objectives. So for us, for this audience, important thing is strengthen knowledge and evidence base through surveillance and research. This is one of the important area just I want to explain. WHO came up with global AMR surveillance system, which is known as GLASS. It is initial step of a global AMR surveillance system, and further development to include other related EMR data. So we came up with 8 bacteria and 4 specimen types. So there is human antibiotic use that is monitored, and in future we'll try to include food chain, environment, and antimicrobial use. In that way, it will be holistic, multidisciplinary approach, and that needs to be developed. So in South Asia, most countries, they are contributing data and information to GLASS. And there is a need to integrate surveillance of antibiotic use and antimicrobial resistance. So it is not only human, food, environment, and animals. So antibiotic use and antimicrobial resistance, they are interrelated. more we use, more AMR problems. So there is need of full integration. And WHO came up with advisory group on integrated surveillance of AMR, which is known as AGISAR. It was established in 2008 and re-established 2014 in the light of Global Action Plan for AMR. And it is mandated to minimize public health impact of AMR associated with the use of antimicrobials in food animals. And there are 36 AMR experts, multidisciplinary group, and the objective is to contain AMR from food chain, capacity building for integrated surveillance of AMR. So AGISAR project was supported in India as a pilot project, and monitoring of antimicrobial use. And there is WHO list of critically important antimicrobials for human medicine that is updated from time to time. And we are also working with tripartite groups and Codex Alimentarius Commission on AMR issue. And there was a XR project in India, and under this Salmonella identification by multiplex PCR, we involve academic institutions and Salmonella antimicrobial susceptibility testing and whole genome sequencing and pathogen characterization. It was started, and it was a successful project, and it is clear that particularly chicken fecal and pig fecal material, they are primary source of this prevalence of Campylobacter salmonella in various parts of India, and Chandigarh is one of them. And there is need to expand network of medical and veterinary colleges and human hospitals. And in fact, we try to support India for this ESBL E. coli tricycle project. Unfortunately, there are some administrative issues, so it was delayed. And another strategic objective is optimize the use of antimicrobial medicines in human and animal health. So we have to understand that there is a link between antimicrobial consumption in human and antimicrobial use in animals, and that leads to antimicrobial resistance in human as well as in animals, and there is interlink and there is interaction. So that's why it is very important to analyze the impact of antimicrobial use on AMR across the sector. And WHO published this guideline for use of medically important antimicrobials in food producing animals. The objective is to preserve the effectiveness of medically important antimicrobials, provide formal recommendation for limitation of specific uses of medically important antimicrobials in food producing animals, and to support global action plan on antimicrobial resistance. So this is the list of critically important antimicrobials. There are criterion as well as prioritization, this criteria, and we have to understand that there are critically important antimicrobials, highly important antimicrobials, and important antimicrobials. So in that way, we should try to support government and authorities to make decision. And definitely to fulfill this strategic objective two related to surveillance and generate evidence-based information, scientific information, we have to understand how resistance develop and is spread, including how resistance circulate within and between animal and human, and through food, water, and environment. That is important for development of new tools, guidelines, government, this informed decision. So that we should try to understand. And that's why there is need of integrated surveillance of AMR. Previously, it was global salmonella surveillance. We are using salmonella as a indicator animal, indicator species. And I will explain why we have taken E. coli. And integrated surveillance of antimicrobial resistance, AGISAR, they developed methodology and a guideline for integrated surveillance AMR in 2013. And we recognize that it is only possible through holistic multidisciplinary approach, that is One Health. And there was a 4-year consultative process with experts from around the world. So that includes experts from low and middle income country also. And it is intended to provide member states with key information on designing a program for integrated surveillance of antimicrobial resistance. And we released guidance on June 2017, surveillance of resistance in animal, food, and humans, surveillance of use in animal and human, combined analysis and reporting. So this is One Health surveillance of AMR. So now we have global tricycle surveillance. It is based on ESBL E. coli. Why we have taken E. coli? Because it is simple surveillance across the three main sectors. If we have taken Salmonella, it can be either trace in human stool, animal, or food, not environment. But the E. coli, ESBL E. coli, it is simple organism and resistance mechanism as indicator. So I have shown how colistin sulfate was used in poultry production and how we detect EMR gene. And definitely it is a complex exercise. So number one is surveillance in humans. So hospital and community that we will try to focus. Second is surveillance in the food chain, chicken in big local market. And third is environment, municipal waste, live animal waste, and upstream and downstream water from human waste. And fourth is molecular biology, so whole genomic sequencing we may use, and we have to get data and information that should be analyzed, and antimicrobial uses and residue that should be monitored, and working package. 7 is country level, regional level, and global level policy and guidance. And addressing AMR using One Health approach, as I already mentioned that 3 organizations, we are committed, and that's why we established tripartite collaboration on AMR. And at the regional level, we have quadripartite regional coordination team, and AMR is one of the priority area for quadripartite action. And how 3 organizations are working together, WHO has GLASS, WHO GLASS. FAO came up with assessment tool for laboratories and anti-AMR surveillance system, a tool for evaluation of antimicrobial AMR surveillance in the food and agriculture sector. And OIE is doing survey, questionnaire survey on the use of antimicrobial agent in animals. So 3 organizations, we have different activities, but that leads to multi-sectoral integrated surveillance of AMR, One Health approach in food chain and environment. And that also help in ESBL EC tricycle surveillance. And regarding this FAO Atlas, India has recently completed this assessment, and many institutions, they were involved. And there are, this is tailor-made, and there are module for laboratory as well as surveillance. And it is done through assessment process by experts. And there are 6 sections, that is introduction, competent authorities, residue monitoring, how it is regulated and governed, technical capacities, reporting communication networks, and safety consideration. And definitely these 5 key components that we have to take into consideration. And based on that, they try to bring different stakeholders together and try to understand the capacity and the validation of those laboratories and restitution of stakeholder meeting, and then it will release the report. And it has been done in most Asian countries. You can see, unfortunately, it was from 2017, so there is no, India is not reflected, but India has recently completed. And now it is a global problem, so we all have to work together. There is a strengthened quadripartite on One Health. So FAO, OIE, WHO, and UNEP, they sign. Yeah, so they sign an agreement, MOU. There is joint vision, commitment, to support countries, whole of the society approach, and we have to synergize our action and mobilize investment. And we came up with One Health Joint Plan of Action, or JPA. This is an option to strengthen, establish a common strategy on One Health. So there are different sector and discipline, society, and ecosystem. So we all have to do better communication, coordination, collaboration, and capacity building. And that's why we are developing implementation plan. And the objective and aim of this JPA is to guide the 4 organizations to work together on One Health to support the member states to build One Health capacity. And this is a framework for action that proposes set of activities that can offer together to enable countries to advance and sustainably scale up One Health in managing public health threat to human, animal, plant, and environment. And there are 6 action tracks. So that includes enhance One Health capacity to strengthen health system. That is One Health governance. And number 2 is reducing risk from emerging, re-emerging zoonotic epidemic and pandemic. That is the focus right now because of COVID-19 pandemic. There are also zoonotic diseases which are neglected. So it is known as neglected tropical disease, and that should also be addressed like rabies, controlling, eliminating endemic zoonotic diseases. Number 4 track is food safety risk. So risk assessment, management, and communication. That is the most important. And action track 5, silent pandemic of EMR, that should be addressed. And last but not least, integrating the environment into One Health approach. I just want to highlight what are the priority action to be taken for EMR, strengthen capacity of countries and knowledge to prioritize and implement context-specific collaborative One Health work to control EMR in policy, legislation, and practices, reinforce global and regional initiative and program to influence One Health response to EMR, and strengthen global EMR governance structure. I just want to highlight G20 summit. It is going to be organized in Indonesia this year, and next year India will be host of G20 summit. So there will be a lot of activities on AMR as well as One Health next year. And the FAO and WHO, we just came up with this tripartite, this assessment, tripartite AMR country self-assessment survey. It is done every year. In 2021, 163 member states, they participated in this survey, and it is inclusive of human health, animal health, and environment. And definitely, COVID-19 pandemic has impacted. So in 2020, the response rate was 70%. Now it is going up 84% in 2021. And it is good that WHO Southeast Asia region, we have scored 100% response from all member states. And it is important that they reflect what is happening at the ground level. So it is self-assessment tool, and it should be interpreted very carefully. And there is impact of COVID-19 pandemic on EMR, implementation of EMR National Action Plan, and how it has impacted. So 151 countries, 93% countries, they said it is badly impacted. And we know that in India, because of COVID-19 pandemic, antibiotics, antifungal drugs, they were used extensively. And it may so result in next few years. And there are also administrative as well as governance impact. So 82 countries said yes, it has. There is an impact, and definitely because of lockdown and travel restriction, this program was on hold. And many staff, they were involved in EMR, they were repurposed for COVID-19 pandemic response. And if we talk about AMR multi-sectoral working group, definitely it is a real challenge that in many countries it is not functional as such, but there is increase in functional AMR working group over the past few years. And we can see that in WHO Southeast Asia, it belongs to that group where it is showing that multi-sector working group, they are functional and clear term of reference and regular meeting and funding for working group with activities and reporting, accountability, management defined. So this is a good progress, but more needs to be done. And EMR surveillance, definitely here we have to understand that overall there is a increase, but still many countries says that there is a standardized national EMR surveillance system collecting data on common bacterial infection in hospital and communities, but it is lacking in animal health and environment sector. So that is a real challenge we are facing. And now it is our responsibility to make sure that the antimicrobial substances we are using, it should be effective. And how to make these existing antibiotics more effective? There are multiple activities, multidimensional and multidisciplinary approach there should be. And antibiotic resistance has no single solution. There is involvement of different sectors, like particularly in food safety and AMR, there is a important role of private sector. So there should be public-private partnership. This is key to prevent misuse, abuse of antimicrobial substances in animal food production. And definitely most countries, they say that we ensure political commitment and leadership and educate the public about how antibiotic works and how they can help halt the spread of resistance. This is also important issue. And if we talk about poultry production, it is matter of livelihood and it is matter of international trade. So there are more challenges than solution, particularly in poultry production sector. And discourage over-the-counter sale of antibiotics. We have long way to go in South Asian countries, and improve hospital hygiene. Thanks to COVID-19 pandemic, now we are trying to promote using face mask, frequent hand washing, and that needs to be carry over. And we all know that COVID-19 pandemic, this transmission rate was very high, and that's why there is an improvement in infection prevention and control. So that is a major achievement from COVID-19 pandemic that we should try to promote, and develop diagnostic kit and rule bacterial infection in and out on the spot. So GUARD, a global alliance for this development of laboratory diagnostics, they are trying to work on rapid diagnostic test kit so that it can be used at the field level, and it should be cheaper. And ban antibiotics as growth enhancer. So this is a real challenge. So officially we can say we ban use of antibiotics as growth promoter, but what is happening at the ground level? So that is a matter of concern for all of us. And use more vaccination to heads up the need for treatment, both in livestock and in animals. So that is very, very important. And India has been pioneer for innovation, technology transfer, and we expect that there will be a lot of new innovative approach to address this issue. And basically this backyard farming, that is a major challenge we are facing because we have not this organized farm like in Europe and America. So that is a major challenge we are facing. And what is the take-home message? EMR is a natural phenomenon, and it depends upon us. We use, that is fine, but if we abuse or misuse, then there will be boomerang effect. and it has biomedical and socio-cultural dimension. So why people are not using antibiotics as prescribed by doctor? And what about the counterfeit drugs? You see, antibiotics, because of poverty and because of this open border. So those things we have to understand. And it is fortunate that India has been global pharmaceutical uh, center, and India is providing a lot of antimicrobial as well as antiviral drugs to rest of the world. So that we have to acknowledge, and that's why we could fight against HIV/AIDS, TB, and malaria. And antimicrobial resistance, it is a complex problem at the human-animal interface that require multi-sectoral One Health approach. So we have explained a lot on this issue, and there are window of opportunities and proof of concept, as we have seen in Europe and as well as other countries. And increased level of awareness and engagement, that is very, very important. And I want to stress the need of public-private partnership in our setting. And global action plan on AMR galvanizes partners around common goal. And you may be familiar that there is Fleming Fund and other international partners. They are trying to support capacity building, policy development, and how to enforce those development activities. And just I want to inform you that the European Union, they have given a project to FAO WHO that is known as One Health AMR project in Asia, and that includes 9 countries. India is one of them. And we have requested FAO to lead this project because it should focus on food safety and how to manage AMR across the food chain. That is the area which is neglected, and there will be activities in coming days in India as well as country like Thailand, Indonesia, and Philippines, and China. And in this aspect, we all have our own role to play. So we have to think globally because it is global problem, and act locally. And as I said, it is transboundary issue. And that's why developed countries, they are trying to invest in our part of the world because it is an insurance for them. So after highly infectious and highly pathogenic diseases like COVID-19 pandemic, multi drug resistance, total drug resistance, TB, they are trying to invest in EMR because that affects them also because of global travel and migration. All those factor affects this transfer of EMR gene. And definitely there is one size does not fit for all. So that's why we should be innovative, try to focus, address those kind of issue. Even in India, health is a state affair. So that's why it is important that we should try to be innovative and try to find solution in the local context, considering the global challenge. Thank you very much.
Thank you very much, sir, for excellent information, updated information on Miss AMR, addressing AMR using One Health approach. Definitely, sir, all the participants, they enrich their knowledge, whatever the information, updated information you have given on the different aspects, Miss global AMR surveillance systems, then global action plan on AMR, and all these control strategies, and you have focused on the awareness and education is required so that the can minimize the use of the antibiotics, and you can go for the vaccination and other measures. Thank you very much, sir, for your valuable information. Definitely, sir, our all these researchers, then PG and PhD students will misuse this knowledge for their research purpose and day-to-day activity. Now, I request the participants, they can ask the questions. 1 or 2 questions, please, participants. Sir, one question is there. Is
Yeah.
there any information on global burden of AMR on livestock sector?
Yeah, it is only in European Union and USA, but not globally, because as I mentioned, it is very difficult to understand what is going on in low and middle income countries. And we have to understand that there are more challenges than solution, like Ministry of Animal Husbandry and Fisheries and Dairy. There is involvement of private sector. There is involvement of small and medium enterprises and backyard poultry farming. So that's why it is very difficult to understand the magnitude of antibiotic use and try to get those information, because it affects trade, livelihood, and this food security issue. So that's why it is very, very difficult to understand what is going on. But in human health sector, there are studies in USA, European Union, and Thailand. So it clearly shows that the hospitalization rate is higher than in those countries, and the burden of antimicrobial resistance is more in Thailand as compared to European Union and USA. So that clearly demonstrate what is going on. And also we have to understand that there are exporting countries like Thailand, Indonesia, India, and we have to follow the requirement of importing countries. So we try to make sure that our products are free of contaminant and veterinary drug residue. But the important issue just I want to highlight is that the frequency of Indian shrimp consignment inspection for antibiotic residue has increased from 10 to 50%. So that clearly shows that there is a concern, and that should be addressed. And yes, it is rejected, and that's why this is it is good for them. And it is also an incentive for us to improve ourselves, particularly for export industry. But what about domestic production and domestic consumption? And if you see result from Bangladesh, Indonesia, and China, it is done by academic sector, sampling of chicken, poultry, particularly poultry sector. It clearly shows that colistin sulfate is extensively used, and that is a matter of concern. So just to answer in one sentence, we do not know the magnitude of antibiotic use in animal food production, and that's why it is difficult to understand the burden of AMR in animal health sector.
Any other participants, please? Last one question. They can directly ask or they can mention in the chat box.
Okay. Okay, sir. Thank you so much, sir, for covering all the topics regarding the initiatives of the. Uh, uh,
So one question is there. What is antibiotic reversal phenomenon?
Hmm.
It's academician. Can I say?
Yeah, so basically what we have to understand is that even in pesticide as well as antimicrobials, this is a biological phenomenon, and definitely resistant strain will appear. And there is also complex this reaction or biochemical reaction, and that leads to those phenomenon. And definitely still it is difficult to understand what is happening. But one thing is sure, that if we use antibiotics in human as well as animal production that will lead to those phenomenon. And still there is need of more research to understand this reversal phenomenon.
Okay, sir. Thank you. Thank you so much, sir, for sharing your vast experience in the field of the AMR. And yeah, you are definitely visiting the many countries, discussing on this AMR issues at different forums. That the experience also you have shared with your topic to all the participants. So, sir, also we will hope you will also participate in various training programs we'll be conducting in the next coming 2 months. Okay, so I hope you will be there for contributing your experience again. And you will speak on functional meat products, the new consumer demands for the better health benefits. So I request Dr. Vivek Shukla to introduce Mendiratha sir to the participant.
Thank you, sir. Good morning to respected Dr. Mendrita, sir, and all other participants. So today I have the pleasure to introduce Dr. S.K. Mendrita, sir. So Dr. S.K. Mendrita, sir is working as a Dean, College of Dairy Science and Technology, Gadwasu, Ludhiana. Dr. Mendrita, sir, has obtained his BVSc, AS degree and MBSc and PhD degree from Haryana Agriculture University, Hisar, in the discipline of livestock products technology. Sir was the recipient of gold medal for his MBSc thesis, and sir was the recipient of CSIR fellowship for his PhD degree program. And after clearing ARS exam in 1992, sir has joined the Agriculture Research Service. And before joining as a dean in the College of Dairy Science and Technology, Ludhiana, sir was served in the different capacities in the Indian Veterinary Research Institute, Nagar, and was the head at Livestock Products Technology Division since 2012. Sir has made outstanding contribution in research, teaching, extension in the institute and in the institute building activities. And he has, and during his illustrated career of more than 30 years, he has done a lot of work to make the institute. Then Sir has successfully completed more than 25 institutes and externally funded projects. And Sir has generated more than 30 technologies. He has 3 patents to his credit, and he has transferred more than 10 technologies to the different entrepreneurs. Sir has guided more than 16 PhD and 12 MBSc students in the capacity of the major advisor, and he has organized more than 25 training programs as a coordinator. And during his tenure as a in-charge dairy technology section uh, and head division of LPT, a scientific coordinator of IVR Redeemed University, and joint director academic, he has brought several significant changes in the institute. And during his tenure, the institute has received many recognitions. Sir has published more than 240 research papers in the different reputed national and international journals, written more than 45 reviews and technical articles. He has more than 50 invited lectures to his credit. He has published more than 7 book chapters. He has edited and authored 6 books and manuals, and he has more than 2,850 citations. He has a H index of more 24 and I-10 index of 63 to his credit. Sir has been awarded the FAO and INSA Fellowship for Advanced Training in USA and Germany in the year 2000 and 2005 respectively. And Sir is the recipient of Best Teacher Award of the IVR Deemed University and ICR Dr. Rajendra Prasad Award for writing technical book in Hindi. Sir is the recipient of Fellow of National Academy of Veterinary Sciences and Fellow of Indian Meat Science Association also. Sir has received many recognition and important assignments from the different central and state agencies. And Sir has worked as a chairman and member of different scientific panels of FSSI, member panels for MOFPI, SEI, DST, APEDA. Sir served as a president of Indian Meat Science Association, member of the Institute Research Council for CPET, CARI, member of the Institute Management Committee for NRC Meat, member Research Advisory Committee for NRC Mithun, and member of the Board of Management for IRA Nagar. So sir has a very vast experience of research and teaching. More than 30 years of teaching and research experience is with sir, and sir has a lot of work in the functional meat products also. So we have the very right person today to deliver his lecture on functional meat products, the new consumer demands for better health benefits. So I request sir to please deliver his lecture. Sir, please. Sir, your voice is little bit less low. हाँ हाँ मैं बोलता हूँ वो करेंगे पता है.
So at the outset, I want to thank the organizer, Dr. Jende, Dr. Vivek, and
Sir, you can put it in presentation mode, your PPT. Yes, sir.
now it is presentation mode. So at the outset, I want to thank the organizers.
Sir, your voice is low.
Okay, I will try to speak up, but in the meantime, I will arrange it. I will try to be louder. I will not.
Sir, please speak loudly.
So I will be divide my talk.
Sir, you are not audible properly. That voice is low.
So I will be discussing my topic in.
Yeah, now it's okay, sir.
Okay, thank you, sir. So first, I will discuss about the requirement, then that how we can get dysfunctional food by manipulating through feed, then by fat reduction, then antioxidant, then fiber enrichment, salt reduction, nitrate reduction. Then I will talk about the functional meat product that we have developed in India, especially in IVRI. Then what is the consumer attitude towards functional meat product in India? And finally, conclusion. So first about the introduction. So actually, as you are that very large number of participants are there in this course, and the topic, your topic of this 4-week certificate course are enhancing livestock production and food safety through One Health approach. So at the onset, I was little bit hesitant that how my topic will fit, how I will can ensure. But afterwards, while reviewing the literature, so I found that it is a very much relevant to the topic, because we can not enhance the livestock production until unless we will enhance its demand, its consumption. If production, it will, if we are having more demand, more consumption will be there, then definitely the consumer can give more price to the producer, and it will help in the improving production also. So now coming to the topic. So before I will discuss about the functional meat product. So first few slides I will discuss about the general thing about functional food. So maybe in your earlier lecture also, so you might be knowing that what is a functional food. So just to revise that, so functional food is any food or food ingredient that may provide a special health benefit beyond the traditional nutrient it contains. So as you know that meat is a very good nutrient food. It is a full of nutrients. It is having all that vitamins, minerals, good protein content is there. But how it will be having that health benefit? So then it will be adding some health benefit, then it will be a functional food. And it will reduce the risk of disease, impart specific benefits, or influence specific physiological. Then sometimes it is confused with the nutraceuticals. So nutraceuticals is made of two words, nutrition and pharmaceuticals. So from nutrition, it only nutrient, first 4 words have been taken, and from pharmaceutical, the rest word have been taken. So then it becomes nutraceutical. That means nutrition plus pharmaceutical properties. Food are part of food that provide medical or health benefits, including prevention and treatment of disease, that are called nutraceutical. Then food fortification and supplementation. So these are also some confusing words. Sometimes we use food fortification, sometimes we use food supplementation. So it involves addition of vitamins, minerals, and micronutrients to the food in order to increase its nutritional quality. Fortification is done to prevent nutritional deficiency for large population. For example, we are doing iodine fortification of salt, or we are doing iron fortification of wheat. But supplementation is done for a specific group. For example, if you are doing iron supplementation for pregnant women, or lactating women, or zinc supplementation for management of diarrhea, so then it will be called supplementation. So if we are going for large population, then fortification. If we are going for small targeted group, then it is supplementation. Then why there is a need of functional or fortified food? So if you see the figure, so more than 2 billion world population is lacking key nutrients such as vitamin A or iron. So this is as per UNICEF data. And then hidden hunger. So 45% of deaths among children below 5 years of age is due to undernutrition. You can imagine 45, almost 50% death that occurred during first 5 years of age is due to undernutrition. Then 50% death is due to other diseases or other reasons are there. But around 50% death due to undernutrition. Then micronutrient deficiencies such as iron, folic acid, zinc, vitamin B12, vitamin D is also very prevalent at a very large scale. So as per this global hunger index that is given for children under 5 years of age in India, so more than 70% are deficient in vitamin D. More than 70%. 57% lack adequate level of vitamin A. 38% are stunted, 21% are wasted, and 35% are underweight. So you can see that how alarming these figures are. But except this iodine fortification of salt, we lag in adopting other food fortification at a scalable public health level, so that we can overcome this much deficiency of this vital nutrient. And also there are nutritional changes are decreasing, the diabetes, hypertension, coronary heart disease, cancer, obesity, overweight. So the incidence of all these diseases, which are basically from nutritional origin, this is also increasing. You can talk any disease, diabetes there, hypertension, so we are taking a lot of fat, then coronary heart diseases, cancer has been also linked with food, then obesity or overweight. So that is hidden hunger. So sometimes, so we are taking adequate food, but this food is lacking in one or other nutrient. So sometimes we are taking so much food that our weight is increasing, but our nutrient deficiency is there. That is called hidden hunger. We have satisfied our hunger, but we have not satisfied the nutrient requirement. Then 1/3 of this death can be prevented by dietary manipulation. So out of this 45% death in the children and similarly at the adult level also, so 1/3 death can be prevented by the dietary manipulation. So by giving balanced diet, by increasing productivity and longevity. So if we will be giving balanced diet, so we will be also improving the lifespan of human being. And also the productivity will be also more. If we will be having good nutrients, then we can perform better in a day, we can perform better in our day-to-day tasks that have been assigned to us. But if we will be lacking in one or other nutrient, then sometimes we will be feeling lethargic, sometimes we will be feeling sleepy, sometimes we will be feeling dull. So if we will be giving adequate balanced diet to a person, then the productivity will be more, longevity will be more. Then coming to Indian scenario, so traditional Indian functional meat or meat product, so although these functional terms have been coined recently in the last 2 or 3 decades, but our forefathers, they were taking this functional food, a functional meat, a functional milk, right from the very old age. So like they were boiling this milk in iron kadai so that the milk gets fortified with the iron. Then they were using turmeric in the milk so that the milk, all the nutrients that are there, all the ingredients that are there in the turmeric, so that benefit can be get into the milk so that immune system will be improved. Then dahi was there, desi ghee, buttermilk. So all these are having so much functional property so that it can be taken care by one or other. Then spices and herbs are being used by us for centuries. So meat curry is full of spices along with dal, vegetable. Then traditional fermented meat product. Then in FSSAI developed regulations for functional food and they have given specifications for nutritional supplements, nutraceuticals, special dietary food, medical and therapeutic food products. Because this importance was recognized long back, but after this FSI formulation, so they have also set standard for all the functional foods. So they have set standard for fortification of wheat, flour and rice, edible oil and milk and salt. So now there are different milk federations, so they are fortifying this milk, and lakhs of liter of milk is being fortified by NDDB, Tata Trust and in collaboration with World Bank, and approximately 2.2 million school children, they are getting fortified milk or milk powder. Now Indian government has also announced distribution of rice fortified with folic acid, vitamin B12 and iron through public distribution system. But this much fortification is not sufficient, because if we will be going only for fortifying milk, because as evident from this map, so only few states, so they are having more preference for milk, but the rest of the country, whether it is eastern state or southern state, so meat is more common diet for them. So we need to think that if we need to fortify this meat also, so that wherever in whatever target population, whether it is children or pregnant women or elder population is there, so they should get the balanced feed or balanced nutrient. So this is high time that besides focusing on this milk or other cereals, we should also focus on, the government should also focus on fortifying this meat or meat products. So another thing about that, if we want, as your topic is that how to enhance the livestock production. So as in the beginning I told you that if you want to enhance production, you have to enhance its demand. So how to enhance the demand for meat? So as it has been indicated in different form that in India, more than 80% population, they want to eat meat or meat products, but they are not getting required meat or meat product as per their choice, because the choice, the consumer concern is changing from decade to decade. If we see in early 70s, it was only price. So consumer was considering only price, that whichever food is cheaper, so they will be buying that. Then comes quality or product range. Then 1990s, it is the welfare issues has also cropped up. Then in 2000, this traditional, then recycling, then organic, pack size, reliability, zero risk, nutritive value, convenience, taste, cost. So all these things have also come, has also been considered. But nowadays, so beside all these, so consumers are also very much aware about this aesthetic factor, natural, innovative, then wellness and safety, driver for health. So driver for health is the most important thing. Nowadays, all our children, our young population, they want to eat food that is healthy. So they may be, whenever they are going for gym, so they may be asking for that imported protein concentrate because they are not getting the required the meat product in our local market. So that is why they are importing this health drink or health food from other countries or from other sources. So now whenever we'll be going for any product, so we need to have a market survey. So what is the consumer demand? What consumer actually want? So there is a increasing potential of this functional food in India. So whether it's meat, milk or egg, so they are rich in bioactive peptides and they are perfect for functional product. So we can easily enrich them. We can easily modify them. And they can be also act as a carrier. So it will be very difficult if we will be fortifying this rice or this wheat because we have to think at a very large scale. But it will be very easy to modify or bring functional property in meat, milk or egg. Then all these livestock products, they are full of many known and unknown components are having nutraceutical or functional value. And new investment is coming. And government is also boosting this processed food sector and many new startups are coming. The increasing disposable income is increasing. The middle class is also booming. So now they are having more income to buy this eatable or buy other things as compared to 10 or 20 years back. The living status has improved significantly. Increasing young population due to dual income family, growing awareness of healthier eating. So this is one of the important factors. So now all our young people, our children, they are more aware about this healthier eating. Then focus on preventive health care, aging population, changing lifestyle, increasing co-prescriptions. Then increasing awareness of ancient Indian traditional medical system like Ayurveda. So now people are again coming back to our traditional medical system. So we have to think that how we can, for example, earlier if we will be adding haldi or if we will be adding spices in our meat product. So earlier they were thinking that the spice is only due to impart taste or flavor. But now awareness is there. Yes, this spice is having many other benefits. It has antioxidant, antibacterial, it will improve immune system. So besides taste, now we will be preferring this spicy product for many other benefits. Then FSI also simplify regulation, and now it is very easy to get approval from FSI regarding these functional foods. Now coming to the exact topic of my talk, that how we can get functional meat and meat products. So we can have these three strategies. One is the modification of carcass composition. So we can have a specific breed. So we can promote breed. Yeah, this is the like Kadaknath chicken is there. So this will be having functional ingredients. So this is the one thing. Then sex, age, feed. For example, if we will be feeding some specific thing to a poultry, so then we can market this product that this meat is grown this meat is from animal that has been fed with organic or that has been fed with this spices. So like this, then feeding schedule, treatment, growth hormones. So that means if either we have to modify carcass composition by adopting either of these strategies, then manipulating meat raw material by just having that specific cut where there will be minimum fat or there will be minimum collagen content, or we can have a composition of different cuts, and so that we can supply the meat as per the requirement of consumer. Then reformulation of meat product by reduction of fat content, cholesterol, modification of fatty acid profile, reduction of biogenic amine, reduction of calories, sodium content, nitrite, phosphate. So it will be reducing all. So all these are the some that bad things that have been attached with the meat product. So if we can reduce all these, so definitely demand will be more. Then we can incorporate functional ingredients. Then vegetable oil, plant-based protein, natural extract, lactic acid, bacteria, dietary fiber, vitamin A, vitamin C, minerals. So we can fortify our meat product with all these ingredients. So then we can also bring functionality in the meat or meat product. So I will be discussing all this one by one. So now functional meat product, what are the requirements? One is the technical aspect, then nutritional aspect, safety aspect, consumer aspect, commercial and legal aspect. So whenever we will be developing any functional meat product, so we need to think that product on all aspects, like whether the formulation is as per the requirement. For example, if we will be developing a product with a zero fat content, of course it will be a functional product, but its acceptability will be very, very low. So whether we will be processing the product as per the requirement. So if we recommend that if we will be not adding this ice or some other ingredient, nitrite or nitrate, then we will get this endowed product with a very good functional quality, but it will be not meeting the requirement of processing conditions. So we need to think all the technical aspects, water holding capacity, pH, yield. So if we will be developing functional product that will be having very low yield, then it will be very costly product. There will be less juiciness, there will be less flavor. So one is the technical aspect. Then nutritional aspect. So what are the health properties? What are the bioactive compounds, phytochemicals, fibers, probiotics? So our aim is to reduce the harmful substance and add the beneficial substances during the processing condition. So how to reduce the harmful substance? What are the substitutes for salt, for fat, for nitrate? So how we can reduce nitrosamine formation? Then what are the ingredients by which we can bring fortification or supplementation? So all this is the nutritional aspect. Then safety aspect means residues, microbiology, associated risk. So if we will be adding some ingredients that will be adding some residue, or that will be adding some that will be increasing microbial load, then also it is not recommended. Of course, it will be adding functional properties, but it will be adding other risks also. Then consumer aspect, that is cost. It should be, if we can little bit higher can be there, but it should not be a big difference should not be there between the original cost and functional food cost. Then shelf life should be either same or should be more than the traditional product. Then sensory, that parameter, flavor, texture, color, juiciness, taste. So we should not bring functionality so that original taste, original color, juiciness should be affected. Then commercial aspect. So if we recommend a process, we generally what we do, we go as per our scientific attitude. So we will develop a process or a production process which is not at all commercially feasible. We will recommend addition of a spice that is not commercially available. So then there is no fun of recommending or doing research on that. We should attempt only those things that are commercially feasible. The legal aspect, limit, validated claim, labeling. Whatever claim we are claiming on a label, so we should validate. Only then we should. Generally, it is not everywhere that scientists generally they become overexcited whenever they will be getting some good result. But especially for functional food, we should have some restriction that unless until we should validate our claim, only then we should be popularizing that product. Then feeding experiment. So I will not go in detail because I don't know that how many of you are from nutritional background. So in the beginning, I told you that by manipulating feed, so we can get the meat or meat product of desired composition. For example, if we will be feeding dry meat, this mealworm larvae, probiotic in broiler diet, so then we can reduce the cholesterol content in the fat, and there will be less density of meat. Then if we will be feeding moringa oleifera leaf, and this also will result in the increase in the omega-3 fatty acids. Then if we feed prepared with this citrus waste peel to the broiler, then it also had a positive effect on the antioxidant enzyme and DDPH radical scavenging activity of the breast meat. Then many other authors, they have reported that supplementation of probiotic in fattening pig diet, it will be also helpful in the bringing functionality in the meat. Then supplementation of this piper, wild bitter, in the broiler diet, it also improves the quality, color, and oxidative stability. Then supplementation of oat seeds, it also significantly enhances the concentration of polyunsaturated fatty acids. Then wheat germ oil included in the broiler feed. Then dietary herbal cocktail powder comprising of chili, turmeric, garlic. So this also reduces abdominal fat deposition and also decreases the drip loss and thigh loss. Then flax seeds, lot of study have been done. So maybe if you want, I can deliver a complete seminar on flax seeds, that how flax seeds. So lot of work have been done that when we'll be feeding flax seed to the animal, so then there will be significant improvement in the this functional property. Then grass-fed lamb sample were treated with the high this PUFA and other this amino acids. Then manipulation of meat as raw material. So first is the manipulation of this feed. Whatever feed we will be giving to the animal, so by manipulating feed, so we can manipulate the composition of meat or carcass. Other is the manipulation of meat as a raw material. So intervention during conversion of meat to muscle. So for example, if we will be giving electrical stimulation, that will affecting pH, tenderness, flavor. That we all know. But besides this will also help the fat oxidation, shelf life, microorganism. There are many other treatments like high pressure treatment is there. By high pressure treatment, so we can reduce the growth of microorganism. We can have more bioactive peptides by giving some treatment to the meat. Then suppression, trimming, or extraction of fat. So this is a simple that we can remove external fat and limit internal fat from the carcass. So whatever visual fat is there, so we can remove that by incision, or from internal also. So if there will be more marbling, then also we can remove. So by this forging or some other technique, some equipments are also mechanically also. So there are equipments by which we can remove the visible fat that is there in the muscle. Then trimming fat from the primal and retail cut, extraction of fat through physicochemical techniques like cryofiltration, centrifugation. Then we can have emulsion-based product with minimum fat. Now techniques are available by which we can prepare a product, a good quality product with the minimum fat content. The only thing, some modification is required in the processing method. But we have to always consider that limitation of fat may have impact on the sensory quality of the resultant product. So we have to make a balance in the sense that we need to improve the quality as per the requirement, but simultaneously we need to take care of the taste of the product also. Then there are different fat replacers have been identified, so that can be used in place of fat, or then we can have a low fat wheat product. So fat rich feed products are directly related to the cardiovascular diseases like cancer and obesity. Use an emulsion gel to replace the partial or total pork fat in the balagona sausages. So emulsion gels have been there, so by which we can, instead of adding fat, it will be adding gel that is made up of soybean oil, soy protein isolate, chia flour, inulin, carrageenan, sodium caseinate, sodium tripolyphosphate. So then we can replace the normal fat with this emulsion gel. Replacing pork fat for the fish oil or liver pate. Then basil seed gum has been successfully used for the low fat sausage. Then rice bran oil in the pork patties have been used to improve the fatty acid composition. The addition of either monosterone rind or mixture of pulp and seeds have also been successfully tried to lower fat content, increase crude fiber in the ready-to-eat pork snacks. Then oat soluble fiber, corn starch, sweet potato powder, milk powder, they have been also tried with a very good success as a fat replacer in different milk products. A lot of studies are there on the corn starch, sweet potato powder, milk protein, oat soluble fiber. Then natural antioxidant in meat products. So as you know that meat and meat products are the highly perishable. So we need to prevent lipid oxidation, that is rancid flavor, off flavor, discoloration, loss of nutrient value, decrease in shelf life, accumulation of toxic compound by using synthetic antioxidants like BHA, BHT, pyroglycol, etc. But nowadays, natural sources are there by which we can have a same antioxidant activity as we can get by BHT and BHA. For example, are onion skin powder, rosemary and citrus, potato peel powder. So they have been used in different products with a very good success rate. So we can easily replace this BHA and BHT by all this natural source antioxidant. Then moringa, oleifera leaf powder, tomato powder has been reported very successful. It improves color, provide antioxidant benefit in the pork sausage, and it is comparable with the 0.1% of the synthetic antioxidant BHT. Then garlic powder. So we can use up to 2% or 3% in the cooked comminuted meat product. Then lotus root powder, green tea extract, edible mushroom in the meat product. So all these are the natural antioxidants that have been tried and can be used in the meat product. So now I will not go that reference wise. So just I have summarized in this table that what are the natural plant source, what are the active compound in this, and what are their functional. For example, in grape seed, flavonoids are there, vitamin C is there, vitamin E, beta carotene is there. So that is having very good antioxidant, antimicrobial effect. Then in garlic, allicin is there. So it decreases peroxidase value, TBRS, residual nitrite content, and also lower the microbial content. Like jackfruit, avocado seed, rosemary. So like different plant sources are there. So they are having active compound in this, and we can use for specific function that we want. And nowadays techniques are also there, so that we can extract the active compound. For example, if otherwise if we'll be adding garlic extract, so we can not add more than 2% or 3% or maybe up to 1.5%. But if we can extract the active compound allicin from this, then allicin can be added to completely replace the BHA or BHC. Of course, this process will be little costlier, but now in the coming time, so this all the active compound, the technology can be easily available for to extract the active compound from these plant sources. Then coming to the fiber source, this fiber is also important for meat products. So meat is a not good source of fiber. So, but we can add pumpkin, inulin, peach, finger, millet, oat, bran, tiger nut fiber, passion fruit, broccoli, konjac flour, legumes, oyster, mushroom, citrus fruit, groundnut seed flour, soya fiber. So all these have been successfully tried, maybe up to 10% in the product, like in chicken meat patties, frankfurter, burger, then balabana. So different formulations are there. Different authors have tried this single or in combination of these fiber sources. So besides improving the fiber content in the meat product, they are also reported to have a functional property like emulsion capacity, emulsion stability, water holding capacity, yield, texture, and also reduce microbial content. For example, if we'll be adding this radish paste, so radish has been reported to significantly decrease the microbial content in the meat product. Then another thing is the salt reduction. So because especially if we are regular meat eaters, especially product like this pickle, so that will be having very high salt content. So now there are techniques, other ingredients by which we can easily reduce the salt content in the meat product. So current level of intake is worldwide is 8 to 10 gram per person per day. But WHO recommended that sodium intake should be up to 2 gram per day. So that is essential for controlling the various cardiovascular diseases. Because sodium is very important for blood pressure or for heart function. So if we will be taking excess sodium, so then it will be directly or indirectly affecting the heart function. So food products with reduction of 33% of sodium content are classified as a low or reduced sodium food content. So there are many chemical substitutes like sodium chloride is there. So naturally also like garlic, onion, radish, so they can also replace the sodium content. So they will be bring some pungent flavor. So the consumer will not feel less sodium or less salt in that particular product. The antimicrobial activity of these spices have been enhanced by presence of sodium lactate. The nowadays seaweed, they have been also successfully used to reduce the salt content. So there are other salt replacers like potassium chloride, calcium chloride, potassium lactate, sodium diacetate, lithium chloride, calcium ascorbate, seaweed. So this is a list of different products where different authors have tried to reduce the salt content in the final product. Then nitrite replacement. So nitrite, if we will be adding nitrate or nitrite in the meat product, and then we will be processing, especially if we will be smoking that product, then there will be formation of nitrosamine. And you all know nitrosamines may be responsible for the carcinogenic effect. So there is there is pressure on the meat scientist or the food scientist to reduce the nitrite or nitrosamine content in the meat product. So this can be reduced by adding niacin, chitosan, tomato peel, Chinese red broken rice powder, celery extract, and starter culture. So by adding any of these, there is also a long list. So we can reduce the nitrite content and ultimately the nitrosamine formation in the final product. So this is another list and the effects that how it have improved the functionality. It improved the fiber content, reduced the cholesterol content, then fatty acid profile, antioxidant potential, delay TBRS value. So each one is having natural ingredients will be having specific role. So now at IVRI also we have developed a series of functional meat products, like starting from designer meat chicken. So instead of using this 100% salt, 1.5 or 2% salt, so we have bring the product to about 0.5% salt plus blend of sodium chloride, citric acid, tartaric acid. Then we also use this sunflower oil as animal fat replacement, combination of pea hull, bottle gourd, up to 10% to improve the dietary fat. Likewise, for each product, we have standardized a formulation for reducing salt content, for reducing fat content, for improving fiber content. So a combination, a blend was identified for each product. So the final product will be having all function quality. If we will be targeting only one thing, then it will be having other benefit also. So it is always better if we will be taking as a product as a holistic, not targeting only single thing, not targeting only the salt or only fat or only fiber. So if we will be adding fiber, we can also reduce fat also. We can also reduce, there are some fiber source by which we can reduce this salt also or fat also. But simultaneously, we have to think about this product quality also. So this will be possible if we will be adding combinations of ingredients rather than only single ingredient. Then chicken meat roll, pork patties. So we have successfully used carrot paste, carrot powder, radish paste, onion paste, raw sweet potato paste or powder, then cabbage powder, red kidney bean powder, so then peanut, almond, pine nut. So all these, so we have tried and we have transferred this technology to the entrepreneur also. So now they are preparing this product and they are marketing also. Then buffalo meat loaves, restructured meat loaves with vegetable extender, low-fat chicken patties, designer pork sausage, chicken nuggets incorporated with selective vegetables. So combination of this carrot, radish or cauliflower paste, or combination of Spanish grit, capsicum grit. So capsicum grit. So actually we never, when we use this capsicum, that Simla mirch, so we never expected that this will bring so much benefit to the meat product. So only in the beginning we tried a paste of this capsicum, but it was having some undesirable effect on the color of the product. But afterwards we tried capsicum grit. So instead of using paste, we have made small grit of this capsicum, Simla mirch, and you may not believe that the appearance of product was so attractive that now that all the consumer of our institutes, instead of wanting normal meat product, they want the product having this green chunks of this capsicum in the meat product. And the flavor was excellent. The shelf life was also improved beside this fiber content, and this microbial content was also reduced. So this single capsicum was having so much benefit that we never expected. Then basil powder, thyme rosemary combination. So now coming to the consumer perception of functional meat products. So despite the desirable elevation in the nutritional value, manipulation of the formulation can ensure many technological difficulties and may have a negatively impact the sensitive properties. So whenever we'll be doing research, so we should always be very conscious that we should not have any negative effect on the consumer acceptability. So widespread consumer acceptance of functional process faces several challenges like low familiarity, minimum belief in the impact that it will be having, that this much health benefit will be there, lack of trust, perceived risk will be there. So it will be very difficult to convince consumer that the product you will be having, so this will be having so much benefit. Consumer may not believe. So in the beginning, if you are going as a startup, or if you will be taking this as a business, then in the beginning you need to take into consideration all these things. In the beginning, you may not get the required response, but you should be prepared for the long-term inning, so that, because it will be, if already something is there, then it will be easy to establish in the market. But for functional food or functional meat product, definitely first 1 or 2 years you need to make your market. Only then you can sustain. If you will be just withdrawing yourself after 6 months or 1 year, then it will be not going to work. So for functional meat product, you need to stay in the market. You have to prepare yourself that in the initial 1 year you may not be getting much profit. Then consumer behavior towards functional food in India. A study believes that the nutritional health link, current purchasing and consumer pattern, positive attitude towards functional food significantly affected the willingness to pay. Consuming less fat, eating more vegetable food has increasing income of food habit, and this is with the changing lifestyle. So in a study conducted, so they have studied different factors that are affecting consumer acceptability. So taste is the most important factor. Then nutrition is the second, cost is the third, and convenience is the third, and cost is the fourth. So as I was emphasizing right from the beginning, that whenever you are going for functional food development, you need to take care that taste should not be compromised. So having same taste, then if you will be going for nutritional improvement, then if you will be going for a costly product also, then also there is no problem. Then in one study by Jan et al. In 2016, so he studied why people are going for this nutritional enriched food. So one is a stay healthy. So every consumer was agreeing that they want to consume this food to stay healthy, to stay attractive. Then for children, this was a surprising observation observed by Jan and workers. So now Indian people, especially, they are more conscious about their children. So if you are targeting anything for the children, for the young, so parents will not mind spending more. If they can spend less on themselves, but they will not mind spending more for their children. Some factors influencing functional food purchasing decisions are the product item, nutritional information, functional ingredient, preparation time, consumer, age, sex, education level, awareness, religion, income, health status. So right product, right functional ingredient, right message, right price, right time, right place. All these are very important for success of a functional food or functional meat product. So then, how to improve research output as far as functional food is concerned? So we should go for need-based research. We should not go for the academic research only. So what is the requirement of our young population? What functional ingredients they want in the meat? Now, for example, I have seen few gyms where they are having their own this meat-based biscuits. That is called high protein biscuits. This is nothing but it is a meat-based. So where they have developed their own technology. So they are drying this meat powder. They are making meat powder, and from meat powder they are making biscuits. But they are having so much that all the clients of that gym, they are having so much confidence on their instructor that they are going whatever that instructor was telling, and the result was also good. So this is what the confidence, we also need to develop confidence among our clients. So when a simple gym owner can develop its own this meat-based biscuits from this from a dried meat powder, why can't we researchers go on that? Then we research need to be carried out as a legacy so that depth of topic can be explored. What we are doing is if one student have done research, then next time we will be going to some other student, some other problem. The multidisciplinary holistic approach is required. So we need to take help of this pharmacologist, nutritionist. Only then we can develop a functional meat product. If we try that we will alone will be sufficient, that is not possible. So if pharmacology will be there in our team, then it will be very easy to validate the claim. Then finally coming to the conclusion. So let thy food be the medicine. That is wrong food, no use of medicine. Right food, no need of medicine. So we need to go for this concept only. Then need-based, in-depth, multidisciplinary approach is required. Proper market research requirement before initiating functional food research. Need to address ethical, legal, and social aspects. Investigation in the context of wider population, consumer acceptance, and expectations. Ingredients shall be balanced in such a way that it satisfies the plate of consumer. Region-wise requirement and strategy are required. So we cannot recommend a one product for whole India. Maybe for one region or one state. So then it will be, then afterwards we can go at a larger scale. Then targeted and comprehensive research is required. Then traditional wisdom and modern knowledge. We need to a blend of both traditional wisdom and modern knowledge to develop functional livestock product. Then characterization and evaluation of beneficial phytochemicals. Technology to minimize loss. Proper validation and design to the standards. Vigilance in the use of terms like nutraceutical, functional, medicinal, and novel food. So we need to use this term as per the requirement. Then SOP and quality control protocol for fortification of meat, milk, and eggs. Then scientific support to the regulatory bodies. Then capacity building and financial support by the government is, of course, it is required if we need to have we need to promote functional meat products, and definitely this government promotion is required. Only then it will be possible to cover the large population. So this was in brief about my talk. So now I welcome any questions. So any query related to functional meat products, so I will be happy to address that. So thank you, Dr. Vivek. Over to Dr. Vivek, an organizer.
Thank you, sir. Thank you, sir, for your very exhaustive and informative presentation on functional meat products. So we have covered all the topics starting from the nutraceuticals, then different approaches to produce the functional products, starting from the feed replacement or manipulation in the feed, then how we can manipulate the products, preparation like salt reduction of nitrite, fat reduction, etc. Then, sir, you have talked about the holistic approach. So that is the most important, that we should not target any particular entity, any particular thing, but we should try to prepare the functional product as a whole. And different approaches you have mentioned about the functional products. And also you have given a very nice information about the changing consumer behavior in India, especially the people why they want to have the functional products. And we have also talked about the different factors which are affecting, which are going to affect the functional products. And you have given also an idea about the improvement in the research output. So thank you, sir. Thank you very much, sir, for your nice presentation, informative presentation. Now I would like to request the participants, if they have any question, so they can ask directly to sir, or they can write in the chat box. So if anybody has, sir, one question is there. I don't know. One of the participants has asked, is there any scientific proven functional food which can prevent the coronavirus infection?
Actually, it is not as such But in immune system, so from IVRI we gave advisory during that Corona period that they should go for, at that time there was apprehension that if we will be consuming meat, so then it may also be having some negative effect. So at that time we tried that meat will be improving the immune system. Only thing we need to educate people. So then that soup was very, we try to advocate soup. So instead of, if you are not able to habitual of taking meat or meat product, if they can take soup also. So soup is also full of all that bioactive compounds, and it will be has been put that it will improve the immune system. It is having spices also. But as such, in market, there is no meat product that we can say that this is a food functional meat product that is available in the Indian market. Maybe in another 5 years or 10 years, we may have a popular meat product. Maybe Lysis or other company may be coming up marketing as this product is a functional meat product. We have to wait for this.
Thank you, sir. Any other question? Any other participant want to ask any question? So, any other question if you want to ask, any one or two question? Thank you, sir. Thank you, sir, for your precious time we have given for this lecture. Instead of your busy schedule, you accepted our invitation and you delivered such an exhaustive talk. So thank you, sir. Thank you very much for your presentation. And we would like to request you that in future also, if we are organizing such programs, so you may deliver the lecture if the physical lectures are also there. So trainings we are also organizing, so you can come here in Mumbai and directly you can deliver, sir. So this is one request from all of us.
Thank you, Vivek. Thank you to Dr. Vivek, Dr. Jende, and all the organizers for giving us the opportunity. So it was my pleasure to share my experience with you. Thank you very much.
Sir, thank you, sir. Thank you, sir. So one request to the participants, tomorrow again we will meet at 11 o'clock. So again, tomorrow there will be 2 lectures. So all of you are requested to attend. Thank you. Thank you, sir.
Thank you.
Hello.